Um, so hi everyone, I'm Rose, or you can call me Rosie. I'm currently working as a postdoctoral research associate at the University of Rochester. So it's actually, we are having a huge time zone difference here because this is actually 3 a.m. in the morning. So please bear with me if I cannot like react so fast to the presentation and stuff. So I'm really grateful to have the opportunity to share with you all about some of my research pathway, what I've learned throughout my research pathway, some of my insights that I've learned here on focusing emotional well-being among the older adults, and also share with you all. And it's a quick highlight of one of my recent published work that is a meta-analysis of using mindfulness-based intervention among the older adults. So, um, so my research focus is actually focusing on improving emotional well-being among the older adults, especially for those at the preclinical stage of dementia. As we may all know that dementia is sometimes people may say that it's a dead end because it is an irreversible and incurable stage of dementia. So most of the researchers, of course, including myself, try to focus on a preclinical stage, including like subjective cognitive decline and also mild cognitive impairment, MCI, in order to help them to prevent progression to dementia or even reverse their condition back to normal. So as in names may imply that cognitive symptoms is definitely one of the core diagnostic criteria among this group of population. So some very common symptoms like impaired short-term memory, having difficulties to concentrate on the task, or even having challenging time in processing complex activities such as calculations are very common among this group of population. But what's come along with it is a group of symptoms called neuropsychiatric symptoms, examples such as depression, apathy, or agitation. And then, so this group of negative emotions not only are affecting up to 80% of this preclinical cohort, but also serve as a significant risk factor that may speed up their progression to dementia. So the reasons why it seems like these cognitive symptoms and neuropsychiatric symptoms were intertwined with each other, maybe because of their very challenging life experience. So I would say one of the very important piece of work during my doctoral study is to conduct a qualitative studies with a group of older adults with MCI in Hong Kong and get to know more about their life experience. And I found that living with MCI is actually a very challenging experience because although their mild level of cognitive decline is not necessarily affecting the independence in their everyday living, but being slowly aware that they were no longer able to engage in everyday tasks or having more errors or mistakes in doing these everyday tasks could be a very frustrating experience to them. At the same time, when they actually doesn't really know what is happening to them, and also receive a lot of criticism from their friends and family, and also hinging on a lot of uncertainty about developing dementia in the future. So when all these stressors adding up together can put them in a very stressful situation and generate a lot of negative emotions, such as particularly depression and anxiety as a result. So I think from one of the very important message bring out by this work is that for the people with, especially at the early stage of dementia, early stage of cognitive decline, we should not only just focus on their cognitive function, but also take care of their emotional well-being at the same time. Although, of course, like cognitive training is definitely one of the most effective or most frequently used treatment for this group of people. But taking care of both cognitive and emotional well-being is actually very important, and it should be the way to go. And then, so based off the results of this qualitative work, so another piece of my work during my doctoral study is actually develop and also implement a multimodal interventions among the people with MCI in Hong Kong. And the meaning of multimodal intervention is actually consists of several components, which is actually designed based on my finding of my qualitative study. So what is multimodal intervention? It means including different kinds of elements, like teaching them what is MCI, engaging them in cognitive training, and teaching them skills in stress management, and also engaging them in active lifestyle. And the results of this multimodal intervention is actually very positive. And I think one of the reasons behind such positive effects is that also the reasons why this is positive is because when I compare to the active control group, I found that these multimodal interventions was able to improve their global cognitive function, depression, and anxiety as a result. And then I think one of the reasons behind such positive results can be explained by the qualitative findings collected after the intervention, because the participants mentioned that such kinds of multimodal interventions were comprehensive enough to capture as much stressors as possible in order to reduce their stress level, and as a result to reduce the generation of negative emotions as a result. So after I think my doctoral study really persuade, at least for myself, that for the people at a preclinical stage, we should not only just focus on their cognitive function, but should extend more to take care of their emotional well-being as well. So after my doctoral study, I asked myself, so what to do next? So I remember this, there's a day I was actually sitting in my living room by myself in my house and thinking about actually what is the meaning behind taking away all these negative emotions. So is that taking away these negative emotions necessarily means that improving their overall well-being? And then I was thinking about this question, not even from an academic perspective, or even just asking myself, my personal motto is actually being happy is very important. Like I would say every life decision, major decision in my life is really driven by whether I feel happy or not. So I start thinking to myself, so is there anything that we can actually do for positive emotions? And then is there anything that it seems like to me that improving their positive emotions is more cost effective, because it can not only taking away their negative emotions, but also help them to achieve more beyond that. And then I even talk about this idea to my current mentor, Professor Kathy Hefner from my institution. And then she actually referred me to read two literature, which I think has a very important effects in shaping my future career pathway, research pathway. So I'm going to introduce to you these two models. So the first one, so from bought and build to undoing. So basically, these two models can help us to understand more about the role of positive emotions in emotional well-being. From bought and build. So the bought and build model is actually proposed by Professor Barbara Fredrickson in year of 2000. And this bought and build model can help us to understand what is the benefit of positive emotions. So basically, board means broaden our thoughts and action repertoire, means helping us to be more open or accepting to the surrounding environment. And from there, it can help us to build personal resources in terms of like skills, knowledge, or social connection. Eventually, it can help us to achieve more, like increase our resilience. So one simple example to summarize this very abstract concept is that because we know that positive emotions can help us to be more open or more accepting to our surrounding environment. So in that way, it is likely that we will engage in new activities or even taking up new hobbies. So of course, throughout the process of taking up new hobbies, it can help us to build new skills, new knowledge, or even meeting new friends. So in that way, it can broaden our social connection. It is also likely that all these kind of personal resources can help us to cope with our challenges in the future. So let's say if we encounter any stressors in the future, maybe this kind of social connection can help us to strengthen our coping mechanism to tackle all these challenges and stressors. So I hope that this simple example can get you to have a better idea of what is bought and build. So a point this bought and build model is undoing hypothesis, and it further help us to have a better understanding on what is the relationship between positive emotions and negative emotions. So as we all know that when we were exposing to stressful environment or depressed or feeling anxious, it's likely that our sympathetic nervous system will be triggered or activated and even trigger a cascade of physiological effects such as increased heart rate, blood pressure, or stress hormones. So the way of positive emotions here can actually help us to counteract all this activation and help us to restore our homeostasis back to normal and speed up the whole process of recovery from a stressful situations. So from this undoing hypothesis, they also proposed that there is actually a magic ratios behind that is using 3 positive emotions to neutralize 1 negative emotion. So when I heard of this magic ratio, it sounds very interesting to me because I don't actually really know how, I didn't really do any research. I'm looking into how they were able to quantify positive emotions or even how to calculate such ratios like 3 to 1. But I think the major principle behind this metric ratios is that positive emotions can not only help us to neutralize negative emotions, but help us to achieve more, to achieve an upward spiraling, to strengthen our coping mechanism in order to, increase our further overall well-being. So after looking into these two literature, I further asked myself, a question is that how we were able to observe or get to apply this undoing hypothesis into our everyday living. So here are the evidence. So according to one very recent meta-analysis conducted, by these authors, is that positive affects can help us facilitate the recovery of our sympathetic nervous system when compared to neutral emotions. And then another study conducted among college students is that having a higher level of trait positive affects, that means a higher baseline level of positive emotions, is significantly correlated to lower negative affects measured 3 months later. So all these literature or studies were actually conducted among younger, healthy adults. So how about older adults? So according to one of my very recent work, which is a secondary analysis of laboratory data collected from 192 stressed older dementia caregivers who were exposing to very stressful tasks in a laboratory section, and found that being able to maintain those positive emotions during such stressful situation were able to weaken the relationship between their stress reactivity and also the subsequent negative emotions. I'm actually very disappointed that I was not able to share this work with you because it is still under review, but I think all this evidence at least can persuade myself that positive emotions were able to at least protect or improve the emotional well-being among different people along the lifespan. So actually, among all the existing literature or existing intervention, one such intervention that is most relevant to positive emotions is actually mindfulness-based intervention. So the reasons why I would say it is the most relevant is because I can see that there is a harmony between mindfulness-based intervention and also positive emotions. So for mindfulness, they focus a lot about talking about expanding our attention to our present moment with an open, non-judgmental and curious mindset. And then this kind of idea is actually echoes very much with what has been proposed by the bottom and build model. As we may recall that it can help us to broaden our outlook and further build psychological resources out of that. And there were more evidence showing that how mindfulness is actually correlated to positive emotions. So trait mindfulness is actually correlated to greater positive affectivity and also lower level of difficulties in emotional regulations, according to recent research. And also one of the process that is mind wandering also we're able to predict increase of positive affects afterwards. So what I want to emphasize is not we just purely focus on positive emotions, but we actually have to take a step backward to overlook and to observe the whole emotional spectrum to include both positive and negative emotions at the same time. So of course, mindfulness-based intervention has been conducted and very successfully for the people with psychiatric disorders such as major depression, anxiety disorder, and also schizophrenia. And very proudly to say, some of these research are also conducted by the researchers from Hong Kong and even from PolyU as well. So I think from what I've learned, at least from this time point, that about mindfulness-based intervention and positive emotion, I can see the potential of improving positive emotions in improving our overall well-being. And I can also see that mindfulness-based intervention may be able to help me to achieve such goal. So I was also wondering whether what is the effects or whether mindfulness-based intervention were able to improve the population of my interest. That means the people at the preclinical stage of dementia, whether they were actually able to engage in such intervention. So because of that, I actually conducted a meta-analysis focusing on mindfulness-based intervention on the population with subjective cognitive decline and also mild cognitive impairment. And this meta-analysis has been freshly accepted by International Journal of Geriatric Psychiatry, and this work is also actually a collaboration between me, myself, and also the collaborators, very important collaborators of mine, which is Dr. Jingjing Zhu from School of Nursing, and she is the research associate professor there. And then, so because of the time limit, I was not able to really go deep into the details of this meta-analysis, but I will try my very best to highlight the main points of it. So this meta-analysis was conducted so this meta-analysis want to summarize the data collected from the randomized controlled trial, focusing using mindfulness meditation as a core component. And I want to capture as much emotional well-being as possible. So this mindfulness, meta-analysis including neuropsychiatric symptoms, positive affects, mindfulness, as well as other psychological related outcomes. And I used R to conduct a data pooling using the immediately co-test data to calculate the center-started effect size using SSG. And here is a very quick summary of the study and intervention. This meta-analysis, including 21 studies, 11 of them focusing on MCI, and then 7 of them focusing on SCD, and then the mean age is 70 years old. And for the mindfulness intervention, most of them are using group section, and for all of them, actually including an in-person section. That means they have to attend the class in person, ranging from 30 minutes to 2.5 hours. And home practice has always been emphasized as a very important element in mindfulness-based intervention. And then for the in-person section, also conducted once a week, ranging from 6 weeks to 3 months. And even under the mindfulness intervention can be actually divided into 4 different types. So 7 of them use a very standardized one, which is a mindfulness-based stress reduction. And then 1 of them use the love-kindness meditation. And particularly for this love-kindness meditation is highly relevant to positive emotions, actually. And then 3 of them from Singapore used mindfulness awareness program, which has been modified particularly for older adults according to certain theoretical framework. And then 5 of them focusing use a combination of yoga and also having a very strong focus of using mindfulness meditation combined together. And then I'm going to very quickly highlight some of the relevant outcomes, some of the outcomes relevant to my presentations today. So for negative emotions, so I found that the results found that the mindfulness-based interventions were able to improve their anxiety, reduce the level of anxiety and stress. And I think that this, and then the results, when I compare to the results reported by the meta-analysis conducted among healthy older adults, and I found that the effect size is actually larger among those with mild cognitive impairment. And then I think one of the very important implications that can help me is that it seems like among this group of people with cognitive impairment, it seems like they are actually having a higher level of stresses when compared to the healthy counterparts. And in such way, mindfulness interventions were able to have a greater impact among this group of people. It also implies that maybe for the healthy population, there is a positive ceiling effects there. And what's more is that I think the mechanism explaining such results can be based on the fact that people with cognitive decline, for the people with cognitive decline, rumination is actually a very common, I would say, phenomenon among them. So just imagine, whenever you are doing some everyday tasks, you're slowly realizing that there's more and more mistakes and errors among them. And then you're also slowly recognizing that you are not able to engage in those tasks. So these kind of like mistakes and errors can actually serve as a reminder, very frequent reminder of yourself that you are not able to do that anymore. So in this way, they actually, rumination is very common among them. But I think the reasons why mindfulness practice may be able to help them is because mindfulness practice focuses so much on telling people redirect their focus to present with a non-judgmental manner. In such way, the people with MC be able to be less judgmental to themselves, and in this way, it could be help them to reduce their stress level and anxieties as a result. And then other things that, and other outcomes that I want to highlight is the positive emotions. So very interestingly, no significant result is actually found for mindfulness, this outcome by mindfulness-based intervention. So I think one of the reasons can explain this result maybe because of the use of the questionnaire by the study. So most of the study, I would say all of the study actually used the 5 P-SETs mindfulness questionnaire, which is actually very frequently used by the mindfulness-based intervention. And then this questionnaire actually received quite a lot of criticism because of one of the P-SETs. That means one of the subscales observed. So for these subscales, some of the study actually found that the item from this scale has been loaded into other factors. And some of the researchers also try to criticize that whether we can actually ease out this subscale out, because it seems like observation is such an important element in mindfulness-based intervention. So it's really difficult for us to tease out this component to be in individual subscales. So maybe it can explain in some way that mindfulness-based interventions are not significant in that way. And then from those researchers and also myself also encourage the use of a combinations of both objective measures such as physiological markers like heart rate variability, neuroimaging data, or third-party evaluation to help evaluating these kind of emotional outcomes. And also surprisingly, although some of the mindfulness-based interventions are highly relevant to positive emotion, just like the love kindness meditation, but they didn't actually measure positive affects as their outcomes. So I think because I'm not going to dig deeper into really talk about the details and discussion of this meta-analysis, but I really want to highlight is that it seems that positive emotions can actually serve as a coping mechanism to against negative emotions and improving our overall well-being. And I think I just want to use my presentation today to really to summarize, to bring home message is that the first one is that using holistic management is very important, particularly for this group of preclinical stage cohort, to not only just focus on their cognitive symptoms, but also take care of their emotional well-beings as well. And then the second bring home message is that we should now maybe it's actually a good way to go, that we should not only just focus on negative emotions, but take a step backward to observe the whole emotional spectrum to try to look into what is the effects of positive emotions, or whether actually positive emotions, improving positive emotions can serve as a way to counteract and cope with negative emotions and help us to achieve overall well-being. So thank you so much again for inviting me to present to you. And then I really hope that my presentations can get you to know more about what is positive emotions, and yeah, hope that maybe it can be emphasized more in the research work in the future. Thank you so much.